Hi, in this video I'm going to be talking about eye and vision problems in people undergoing anti-cancer treatment. It's not uncommon for me to hear that I can't see as well or my eyes are very dry. We know that with a lot of chemotherapy agents, we do see dryness of the eyes. It's really important to let your medical team know if this is happening. If you develop eye pain or redness, that's also really important. Most important is if you have sudden change in your vision, something acute, that's a medical emergency. Don't mean to alarm you, but something where it's not creeping up on you between chemo visits, but it happens all of a sudden. Might not even be related to your treatment. There are a few medications that are known for causing problems with the eyes. Exabebalone is one of those, and 5-fluorouracil, or the oral version, capecitabine. Those are the two most common, but really any chemotherapy can cause problems with dry eyes or irritated eyes. The other thing that I've noticed is that we put people on corticosteroids or steroids to help prevent nausea. It's very important to prevent nausea, or for some drugs to prevent you having an allergic reaction. When people are on steroids, this is not an irreversible change, and it's not related to diabetes if you have it, but I've noticed that people will describe blurry vision. Now, if your eyeglass prescription's outdated, that could also explain it as well, and the type we give you is so small, maybe you can't read it. But I generally recommend waiting to get a new prescription until after you're done with chemotherapy, probably 2-3 months afterwards. Otherwise, you're going to have a pair you can't use long term. So that's chemotherapy and what we see with corticosteroids and with some of the chemo agents. It's also important to know that tamoxifen and its cousin, tamoxifen light or raloxifene, have rarely been associated with retinal toxicity. The retina is the back of the eye. And while some people talk to their patients about this a lot, it's actually pretty uncommon. The only reason we know about it is because we followed thousands and thousands of people to look at their long-term side effects. As with most side effects related to tamoxifen or raloxifene, Ferriston, which is another one, or teremafene, these are all drugs in the same family. The risk increases with the longer you are on the medication. So 2.5 years or even 5 years, we don't tend to see a lot of ocular toxicity. How do you take care of your eyes? Well, as with everything, we recommend that you wash your hands really well before rubbing your eyes, and try to avoid rubbing your eyes if you can. You don't want to cause any abrasions or scratches to the surface of your eye. Use artificial tears. Try not to use Visine or other brand names that get the redness out. Those actually can cause rebound redness of the eyes. And make sure to let your medical team know, your nurse practitioner, physician assistant, or any one of your doctors. You can also let your primary care doctor know. And most of the things that we do are non-invasive and over-the-counter. You can use flexible spending money for eye drops, which I just recently found out, so that's nice to know. You can also put warm compresses on the eyes if they're itchy or dry, and eyelid scrubs. They're very soft tissues you can use to make sure your eyelids stay clean. If you have pre-existing dry eye syndrome, you'll want to let your eye doctor know that you'll be starting chemotherapy so they can help keep track of you as well. I've covered a lot. I hope it's been helpful. If it has, click like and subscribe. This helps other people just like you find this video. If you want to learn more about your breast cancer and your treatment options, go to Yerbba.com.